given at that time. If you should require assistance during the call, please press star then 0 and an operator will assist you offline. I would now like to turn the conference over to the Executive Director of the Office of Immigrant Affairs, Rigo Reyes. Please go ahead.
Thank you. Thank you and welcome to our weekly Ethnic Media Press Conference. We hope that you and your families are in good health. And once again, we thank you for all you do to support our communities get through this pandemic that has inflicted so much pain on all of us. Again, my name is Rigo Reyes. I'm the Executive Director of the Office of Immigrant Affairs in the Department of Consumer and Business Affairs. The Los Angeles County is working around the clock to help all our residents, particularly those most vulnerable, overcome the ravaging impact the coronavirus has inflicted on all of us. And as we continue our recovery stages, we must keep reminding ourselves that we are all responsible for following safety protocols such as physical distancing, wearing masks, and frequent hand washing. The county also recognizes that we must pay special attention to helping those most vulnerable, such as our senior citizens and individuals with underlying health conditions who are at much greater risk of getting COVID-19. But to be successful, the county needs the help of trusted partners like you, the ethnic media, our community partners, to provide timely and, most importantly, trusted information for our immigrant communities, our immigrants and their families, so that they learn about the services available to them. And again, we need to constantly remind ourselves about how important it is to stay vigilant and follow health safety protocols to protect ourselves, our families, and our communities. Today, you will hear about two very important programs, the Great Plates Deliver program that delivers 3 meals a day to eligible senior citizens and others at high risk of, so they can stay home. And you will learn the latest information about safety protocols. At this point, I would like to, I'm honored to thank and to introduce our host and special guest for her vision and leadership in elevating the importance to protect the well-being of all our county residents, regardless of their immigration status, and particularly, as I said, those most vulnerable. Please welcome our host and special guest, Supervisor Hilda L. Solis, representing the 1st District of the County of Los Angeles. Supervisor?
Good afternoon, everyone, and thank you, Rigo, for that very kind introduction. I want to welcome everyone to today's Ethnic Media Briefing. And first of all, I want to thank the Office of Immigrant Affairs and our Joint Information Center for their continued efforts to ensure our diverse county population is able to receive important information from their trusted messengers, our partners in the ethnic media. You know, last week, LA County's public health officer announced a revised public health order allowing the reopening of key economic sectors. As LA County continues on its roadmap recovery, we may be tempted to think that the virus is no longer a threat. But the truth is the coronavirus remains a threat to our communities, which is why we must continue to adhere to safety protocols. When outside of your home, for example, please wear a cloth face mask covering to protect yourself and others. And when visiting a museum, a gym, or a hotel, or even a restaurant that allows you to dine in, someone may take your temperature. Our health officer orders urge that we continue to practice social distancing, remain vigilant about washing your hands, and wear face coverings to help slow the spread of COVID-19. You'll hear more about this from Dr. Barbara Ferrer about best practices for keeping yourself and others safe and healthy. And for a list of what is open and what remains closed, visit covid19.lacounty.gov/. I know many families have been impacted by COVID-19 and are struggling to put food on the table at this time. I see that just about on every occasion when I'm out there with our local food banks to help distribute food and items to many individuals in need. We need our media partners to help us get the word out about our new LA County program launched by the state. And the program is called Great Plates Delivered. Great Plates Delivered does the following. It will provide 3 home-delivered meals per day to qualifying adults 65 years and above, and adults 60 to 64 who are at high risk of COVID-19. And it will help to stimulate the economy by bringing back to work employees from our restaurants, our hospitality, and transportation industries. We've launched an online application for clients in both English and Spanish at the following: wedax.lacounty.gov/greatplates. And I encourage people to go to the website and apply if you feel you're eligible. The state and federal governments have several requirements that applicants must meet in order to participate in the program. But be assured we'll never ask applicants about their immigration or their citizenship status. Otto of our County Department of Workforce Development and Aging and Community Services is here today also to provide you more details about the program. But please go to wedax.lacounty.gov/greatplates or simply call 211 to sign up for this important anti-hunger program. And lastly, I want to remind you that today is a very special day. Today is Census Day of Action. Several nonprofits have organized car caravans throughout LA County and some of our cities to travel through communities and neighborhoods with historically low response rates. And they're doing so because we want to encourage everyone to respond to the census. The census is conducted, as you know, every 10 years, and it's used to distribute more than $800 billion in federal funds to our communities, and especially in hard-hit places like LA County. When you respond to the census, you're helping to ensure that the county gets more federal funding for programs like health care, education, libraries, food assistance, housing, and other critical services and programs that all of you I know care about. The self-response rate for the state of California as of June 15, 2020 was 62.5%, which is slightly above the national response rate of 61.4%. However, I want to remind you that the response rate for Los Angeles County is only 57.5%, which means we still have a lot of work to do. Thus, the deadline to respond to the 2020 census has been extended to October 31st, 2020, but I'm not telling you to wait. Don't procrastinate. You could mail in your census form or respond by visiting 2020census.gov or by calling this telephone number, 844-330-2020. You'll hear more about the 2020 census from the Office of Immigrant Affairs. I want to thank you again for joining us today and for always keeping your dial fixed to LA County. As always, you can always call assistance at 211 LA County for more information. And with that, I'm going to transition very quickly and briefly in Spanish. Buenas tardes. Gracias por estar aquí hoy día con nosotros. La semana pasada, el oficial de salud pública del condado anunció una orden revisada que permite sectores de nuestra economía a reabrir. Mientras el condado sigue en su recuperación, podemos pensar que tal vez el virus ya no está aquí. Pero la verdad es que el virus sigue siendo una amenaza para nuestras comunidades y necesitamos protegernos. Cuando están fuera de su casa, por favor pongan su tapabocas. Así se protege a usted mismo y también a los demás. Incluso cuando visitan a un hotel, museo o lo que sea, pueden ser que alguien va a tomar su temperatura. Les recuerdo, todavía no hemos salido de la crisis de COVID-19. Les pido que por favor mantengan al menos de 6 pies de las demás, si es posible, y siguen lavándose las manos con jabón. Y que muchas familias ya sabemos que han sido impactados por COVID-19 y están luchando por poner comida en la mesa. Lo veo cada vez que estoy afuera dando regalos y bolsas de comida a personas que tienen muchas necesidades. Hoy les quiero hablar de un nuevo programa en el Condado de Los Ángeles, lanzado por el Estado. Se llama Gran Platos Entregados. Este programa ofrecerá 3 comidas por día a personas de la tercera edad quienes están en alto riesgo de COVID-19. Y tenemos una aplicación en español y en el Internet para personas interesadas y se puede encontrar en esta página, wedax.lacounty.gov/greatplates. O si no, simplemente pueden llamar a 211 para pedir más información. Pero también no deben de tener miedo porque nadie les va a preguntar su estado de inmigración o ciudadanía. Por favor, llámanos a 211. Por último, les quiero recordar que hoy es el Día de Acción del Censo. Varias organizaciones organizadas caravanas de coches por todo el condado, especialmente en áreas donde conocemos nosotros, donde viven muchos latinos. El censo pasa cada 10 años y ayuda a distribuir fondos federales a nuestras comunidades. Estos fondos apoyan servicios de salud, educación, librerías, comida y viviendas y otros servicios muy críticos que la comunidad quiere. Es muy importante que todos estén contados. Entonces, por favor, llama y informarse cómo pedir la aplicación para formar con el censo. Ya saben que si necesita más información de parte del condado, pueden llamar a 211. Por favor, sigue manteniendo distancia a los demás y usa su tapabocas y lávense sus manos. Y es muy importante que sigan bajando la curva del virus. Muchísimas gracias a todos.
Good afternoon. Thank you so much, Supervisor Solis, for inviting me to be part of this briefing and for all your leadership across the county, particularly during this very challenging time. Today, I want to talk about how our day-to-day lives have changed during the COVID-19 pandemic and the tools that we continue to need to use to slow the spread of the virus. LA County is well into our recovery journey, and many businesses have reopened. People are going back to work, and many of us are out of our homes more. As we're out more, it feels like life is coming back to normal. And so it can be easy to think that we're on the other side of the pandemic, but that's just not true. COVID-19 is still in our communities. People are still becoming infected with the virus, and some people are becoming seriously ill and unfortunately passing away. In particular, people with underlying health conditions like asthma, heart disease, and conditions that weaken the immune system are particularly at risk for becoming very seriously ill from COVID-19. And this is also true for people who are older. Simply put, the virus has not changed. And we know that there are many people who are positive for COVID-19 who never develop symptoms and have no idea that they're able to infect other people. We are likely many months away from a vaccine, so this means that the way we live our lives for the foreseeable future will need to include taking careful steps to protect ourselves and, most importantly, to protect each other. For individuals, this means when you're out and about other people, you need to practice physical distancing of at least 6 feet and always wear a cloth face covering. These actions, as simple as they seem, are very powerful in slowing the spread of the virus. They prevent droplets from the nose and the mouth of a person who is positive for COVID-19 from infecting other people. If you're keeping your distance and you're covering your nose and mouth, it's far more difficult for you to infect another person. And if you test positive for COVID-19, it's important to remember that you need to isolate for 10 days and 72 hours after you have symptoms, after your symptoms and your fever subside. This does mean staying home, not going to work, and only leaving for medical appointments, and also staying away from other people and pets as much as possible. If you're positive for COVID-19 and you can, you should use a separate bathroom from others. And please don't cook meals for others or share utensils with any other people. We do have detailed information on on isolation in multiple languages on our website, publichealth.lacounty.gov, along with resources that may become useful for you to stay home safely. If you're tested positive, you will also be contacted by the Department of Public Health. And it's important, please answer or return our calls. We will ask you about the places you've been and who you've been in contact with while you may have been able to infect others. And it's important that you know that all the information you give us is confidential. And we never ever ask for money, your social security number, or your documented status. We do use the information you give us to contact anyone who has been exposed by you, though we never tell the people we contact who possibly exposed them. If you've been a close contact of a person who has been exposed to COVID-19, you too will need to quarantine for 14 days. This means staying home, not going to work, and staying away from other people as much as possible, because you could become or be infected with COVID-19 yourself. There are details on how to self-quarantine in multiple languages on our website as well. And for businesses that are reopening, we're glad you're able to reopen. We have issued protocols for opening every sector as safely as possible for both employees and customers. In particular, we want to make sure that people who must do their jobs on site, that can't telework or work from home, are as safe as possible while they're at work. The protocols we have issued are requirements. They are not suggestions. They require businesses to keep physical distance for both employees and customers as much as possible. And employees and customers are also required to wear face coverings when they're around other people. Other infection control practices are included, and this is like frequent cleanings and allowing employees to wash their hands often during the day. Employers do need to fill out a checklist that notes all of the infection control protocols that they're implementing, and they need to share this list with their employees. And for people who are visiting reopened businesses, please follow all of the rules as you're directed. It's important to note that there are a number of benefits for workers who have been affected by COVID-19. There's disability insurance that's available for people who are unable to work due to quarantine or illness related to COVID-19. There's paid sick leave for people who are sick or have a family member that's sick, or if you or a family member need preventive care. And there's paid family leave that's available to people who are unable to work because they are caring for someone who's ill or someone who's quarantined. There's also unemployment assistance for people who have lost their jobs or their businesses or have reduced hours because of the pandemic. There are a number of other benefits that are available for people who have been affected by COVID-19, and a list of these resources is available on the Department of Public Health's website, publichealth.lacounty.gov. In closing, I encourage you to use the tools we have to slow the spread of COVID-19 and to follow the protocols for reopening businesses very closely. Making our way to the other side of the pandemic requires that we all continue to do our part and work together for the foreseeable future. These actions are the key for a successful recovery journey. They prevent the spread of the virus and they save lives. Y ahora en español. Muchas gracias a la supervisora Solís. Estoy contenta de ser parte de esta sesión. Hoy quiero hablar sobre cómo nuestra vida ha cambiado durante la pandemia de COVID-19 y lo que debemos hacer para frenar el virus. El condado de Los Ángeles está en su camino de recuperación y muchos negocios han reabierto. La gente vuelve al trabajo y muchos estamos afuera de nuestros hogares. Mientras que salimos más y que la vida parece volver a lo normal, Puede ser fácil pensar que estamos en el otro lado de la pandemia, pero eso no es cierto. COVID-19 todavía está en nuestras comunidades. Las personas aún se están infectando y algunas personas se enferman y hasta mueren. En particular, las personas con problemas delicados de salud, como asma y enfermedades del corazón, corren un riesgo de enfermarse gravemente con COVID-19. Esto también es cierto para las personas mayores. En pocas palabras, el virus no ha cambiado y sabemos que hay muchas personas que son positivos, que nunca tienen síntomas y no saben que pueden infectar a otros. Puede ser que nos faltan muchos meses para recibir una vacuna y por eso la forma en que vivimos nuestras vidas debe incluir tomar medidas para protegernos y a nosotros mismos y a los demás. Primero, cuando estás afuera y cerca de otras personas, mantenga una distancia de 6 pies y use una cubierta de tela para la cara. Estas acciones son simples, pero son muy poderosos para frenar el virus. Evitan que las gotas de la nariz y de la boca de una persona positiva para COVID-19 infecten a otras personas. Si mantiene la distancia y se cubre la nariz y la boca, es mucho más difícil infectar a otra persona. Si su prueba de COVID-19 es positiva, es importante que se ponga en cuarentena durante 10 días y 72 horas después que ya no tenga síntomas o fiebre. Esto significa quedarse en la casa, excepto para citas médicos, y quedarse lejos de otras personas y mascotas cuando sea posible. Si es positivo para COVID-19, use un baño separado de los demás si es posible, y no cocine ni comparta utensilios con otras personas. Tenemos más información en varios idiomas en nuestro sitio web, publichealth.lacounty.gov, junto con los recursos que puede necesitar para quedarse en la casa en una manera más segura. Si sus resultados es positivo, el Departamento de Salud Pública también te va a llamar. Es importante contestar o devolver nuestras llamadas, ya que le vamos a pedir los lugares donde ha estado y con quién ha estado en contacto mientras puede infectar a otros. Es importante saber que cualquier información que nos dé es confidencial y nunca vamos a pedir dinero, ni su número de seguro social o su estatus migratorio. Vamos a usar esta información para llamar a cualquier persona que ya haya estado expuesta, aunque no le diremos quién lo expuso. Si ha estado en contacto cercano con una persona que ha estado expuesta a COVID-19, deberá ponerse en cuarentena durante 14 días. Esto significa quedarse en la casa, no ir a trabajar y quedarse lejos de otras personas como sea posible. También hay más información en varios idiomas en nuestro sitio web. Para los negocios que están reabriendo, el Departamento de Salud Pública ha dado directivos para abrir de la manera más segura para los empleados y los clientes. Las directivas son requisitos, no sugerencias. Exigen que las empresas y los negocios mantengan la distancia física tanto para los empleados como para los clientes. Los empleados y los clientes también tienen que usar cubiertas de tela para la cara cuando están cerca de otros. Hay más prácticos de control de infecciones como limpiar más seguido y permitir que el personal se laven las manos con frecuencia. Los negocios deben llenar una lista para verificar que cumplen con las directivas y mostrar esta lista a todos sus empleados. Y a las personas que visitan estos negocios también deben seguir todas las reglas. Es importante saber que los beneficios para los trabajadores que han sido afectados por COVID-19 son muchos. Y hay una lista que está disponible en el sitio del Departamento de Salud Pública, publichealth.lacounty.gov, con mucha información sobre estos beneficios. Para terminar, les pido que sigan las directivas para los negocios. Hay que seguir haciendo nuestra parte, trabajar juntos para llegar al otro lado de la pandemia. Muchas gracias a todos y ahora viene a hablar el señor Solorzano.
Thank you, Dr. Ferrer. Good afternoon, everyone. Buenas tardes. Thank you for having me today. My name is Otto Solorzano. I'm the acting director for the Department of Workforce Development, Aging, and Community Services. I'm here to talk about the Great Plates Deliver program. This is a program that was launched in coordination with FEMA as well as the state of California, and it has two objectives. The first one is to provide 3 meals a day to eligible seniors. Secondly, bring back workers in the restaurant industry. We know that the hospitality industry was badly affected during this pandemic. Starting this week, we are expanding our outreach efforts to make sure more people come and be a part of this program. We've had many seniors interested in the program, but unfortunately, many of them have not met the eligibility requirements required by FEMA. So today, I'd like to just kind of briefly talk about the eligibility requirements, making sure that our immigrant community is aware of them. And they are very simple. There are 5 eligibility requirements. First, you need to be 65 plus, more than 65 years old. Second, you need to be unable to prepare your own meals. Third, you need to live alone or with another eligible adult. Fourth, you cannot be receiving CalFresh or SNAP aid. And the fifth one is you must have an income between $25,000 to $75,000 a year if you live alone, or if you live with another person, between $34,000 and $101,000. Those are the 5 criteria for you to be eligible for this program. Filling the application is actually rather simple. We're asking you to come and apply. You see on the TV our email address, wdacs.lacounty.gov. There is an application process that gives you the 5 questions. It's very easy to answer, and at the end, you will know whether you are eligible or not. Another way in which you can apply is going to 211. 211, there's been a number of individuals calling, so it may take a little bit of time to get responses, but the benefit is that there are a number of individuals there who speak just about every language. I'm pleased to report that so far we've provided about 150,000 meals to over 2,100 seniors. Now, the other piece of the program is restaurants, because we're asking local restaurants to provide meals. We currently have 45 restaurants providing meals. The number of restaurants that we contract out is dependent on the number of seniors that live in their actual communities that are eligible. The more seniors we have that are eligible, the more restaurants we will be able to bring. Right now, we don't have enough seniors on our waiting list, so we've temporarily capped the number of restaurants that are under contract with the county to provide meals for seniors. But that's the reason we are here to talk to you. We're asking the ethnic media to help us market this program, to let people know that they are eligible to receive these services. The program is free. It is really self-attestation, self-certification. You don't need to have any documentation. All you need to do is self-certify that you are giving us the right information. The program is free, and as I said, there would be 3 homemade delivered meals every day of the week. We currently have authorization to support this program until July 10. We've had some assurances that FEMA may extend the program until August 10, 2020. So hoping that that would be the case, we would have much more individuals that could, or more seniors that hopefully will be able to join this program. Ahora déjenme decirlo un poquito en español. Primeramente quiero darles las gracias. Estoy aquí porque estamos en un programa que le llama Grandes Platos Entregados. Este es un programa que el Condado de Los Ángeles está implementando, trabajando con FEMA y el gobierno de los Estados Unidos y el estado de California. El programa tiene 2 objetivos. El primero es que cada persona que tiene más de 65 años reciba 3 comidas diarias, 7 días a la semana. El segundo objetivo es traer a todos los restaurantes para que ellos puedan traer a las personas que están trabajando. Mientras más personas pueden venir y trabajar, más vamos a estimular la economía. Para que usted aplique es simple. Usted tiene que cumplir 5 criterios y voy a dárselos ahorita. El primero es si usted tiene más de 65 años. El segundo, si usted no puede preparar sus propias comidas. El tercero, si usted vive solo o con alguna otra persona que también es elegible para este programa. Si usted no recibe asistencia pública como CalFresh, y si usted tiene un salario, y esto es muy importante, si usted tiene un salario entre $25,000 y $75,000 si usted vive solo, o si usted vive con otra persona entre $34,000 y $101,000, usted es elegible. Por favor, aplique. Todo lo que usted tiene que hacer, usted ve en la pantalla www.lcounty.gov. La aplicación lleva posiblemente unos 10 minutos al máximo. Es solamente unas preguntas yes, sí o no. Y entonces, dependiendo de eso, usted va a recibir confirmación de que usted es elegible para ese programa. Lo último es hablando específicamente con los restaurantes. Los restaurantes, tenemos 45 restaurantes ahorita que están proveyendo los servicios. Estamos dando casi 150,000 comidas hasta este momento a más de 2,000 personas. Estamos tratando de encontrar más personas, particularmente personas que vienen de nuestra comunidad étnica, para que ellos puedan también aplicar a este programa. Como les he dicho, para aplicar pueden ir a www.lcounty.gov. Noah, we are ready for questions.
Certainly. Ladies and gentlemen, if you wish to ask a question, please press 1 and then 0 at this time. You will hear an acknowledgement tone indicating you've been placed in queue. Once again, if you have a question, please press 1 and then 0 at this time. And it will be 1 moment for the first question.
Thank you. Thank you. While we get ready for any questions that may come up, I just wanted to take 1 more minute to remind our listeners in Spanish about the census. 1 minuto para el censo 2020. Es importantísimo que todos contemos. Es fácil, es seguro y es rápido. Toma 10 minutos para completar el formulario, para hacerlo por medio del internet y también hasta se puede hacer por teléfono. La información está protegida por ley, no debe compartirse con nadie más que con el censo, así es que no hay que tener pendiente. Y más que todo, para poder mirar por el futuro de nuestras familias, de nuestros hijos, de nuestras comunidades, que reciben fondos basados en el número de personas que vivimos en estas comunidades por parte del gobierno federal, es importantísimo contarnos. Estamos observando el Día de Acción, así es que les pedimos que por favor no lo dejen pasar, completen el censo de vuelta. Es fácil, es seguro y es rápido. Now we're going to check for questions. Again, 1-0. If there are no questions, there is one question. So please, operator, if you can let the question be heard.
Certainly, and as a reminder, it is 1 and then 0 to queue up. Our first question will be from Linda Palacios. Please state your media outlet, followed by your question.
Hi, yes, this is Linda Palacios. I'm an intern with CCS. I'm just wondering if there's a phone number for people to call for this program.
Linda, thank you very much for joining. Definitely, that's a very good question. I would encourage anyone to call our Office of Immigrant Affairs to get the information to be connected to the right place. It's 1-800-593-8222. We will provide the service, the resource, or we will connect the person to the right place. Thank you again.
Thank you.
And at this point, I'm informed there are no more questions, so this will conclude this press conference. Thank you again. We appreciate you very much for all the work you do on behalf